Can you see full screen? Hello, everyone. My name is Scott DeRuyter, and I'm the Regional Service Manager for Student Care, and we're the administrators of the MSA Health and Dental Plan. And I'm going to present to you a lot of information about the winter 2021 starting of the plan. So welcome, and let me get started. So what is the plan? That's the big question at first, of course. And the plan is, it's an extended health and dental plan. So it actually goes above and beyond what OHIP, for example, would do for Ontario residents. So the basic insurance is covered elsewhere. This is an extended, so it does for dental, it does for prescription medications, it covers physiotherapy, chiropractic, massage therapy. So there are many benefits to having an extended health and dental plan. So this is just like an employer health and dental plan. So it's actually a wonderful thing to have because OHIP and your basic insurance doesn't cover most other things like dental, for example. So this is a service provided by the MSA, and we're the administrators, as I said, and we actually have over 1 million students covered by our plans currently. So we are the leading provider in the country. So here's a little example of the types of coverage you have. So a core or basic health coverage is either covered if you're a Canadian student. On the top, you'll see Canadian students are covered by provincial Medicare, which in Ontario is called OHIP. And if you can see, excuse me, international students are covered by a core health plan as well, which I believe is GuardMe at Mohawk. And both Canadian and international students are covered by an extended health and dental plan, which is extended health coverage, as I mentioned, prescriptions, practitioners, dental coverage, etc. So both students are covered. And who's covered at Mohawk? Well, full-time students and co-op students at Mohawk enrollment programs. They require the ancillary fees to be paid to the MSA starting in September, January, or May, and they should be automatically billed and covered for the plan. Just make sure that you're automatically billed. Check your tuition summary because we don't have access to that here at Student Care. And you can actually see you'll be billed for the MSA Health and Dental Plan. Then you know that you're covered for the January start. And there are 3 different billing cycles at Mohawk. You have some students, depending on their stream and what program, they may be billed for 1 term, 2 terms, or full year. So there are different rates. But who's not covered, importantly, part-time students that are paying 40% of their ancillary fees aren't automatically covered, but may be able to enroll yourself during the change of coverage period, which is currently ongoing. It's the first 2 to 3 weeks of the term for new students. If you were started in fall, for example, you wouldn't be able to change your coverage now. You can only change your coverage at the start of the new policy year, which is September to August, or on your first term of the policy year. So if you're new starting in January, now's the time you can change your coverage. So part-time students enrolled in programs requiring less than 40% of the ancillary fees and continuing ed students aren't covered and cannot self-enroll. So you have to be billed at least 40% of the MSA ancillary fees to be able to self-enroll. But if you're full-time, you should be automatically billed. Just help check your tuition summary. And once again, the change of coverage period, or excuse me, the coverage period for fall is September to August, and winter's January 1st to August, and it is a prorated amount. So you're billed 2/3 of the fee from January to August if you start in January, for example. So you can see on the screen, we actually have health coverage for you up to $10,000 per policy year. It covers their prescription drug coverages, psychologists, like physiotherapists, chiropractors, medical equipment, and a lot more. Our website is full of great information. Vision, you have up to $350 towards eye exam, laser eye surgery, or eyeglasses, and dental up to $750 for checkups, cleanings, fillings, anything that would happen that like an annual checkup, for example, is a great idea. And a new patient exam is something very expensive. So if you already have practitioners in all of these fields, I still recommend that you go onto our website and see if you have, if you find one of your providers is on our network providers, they will actually give you an additional discount because you are now covered by the MSA plan. And travel is covered up to $5 million per lifetime and up to 120 days per trip. Trip cancellation and interruption due to a medical emergency is also covered. So the cost. So you can see the annual fee is $203.24. The winter fee, like I mentioned before, is 2/3, and excuse me, and a single term is $67.75. And as a new student in January, you can enroll your family members during the change of coverage period, which ends rather soon. So keep that in mind. Get on our website. You can add one dependent for $203.24. And you can add unlimited for $406.48. Now this is full year, so those would be prorated for the 2/3 year. The change of coverage period, once again, January 6th to 22, so it's coming up. The end is coming shortly. You won't be able to change your coverage again until next policy year, which starts September 1st, during the change of coverage, which, like I said, is usually the first 2 to 3 weeks of the term. We have a secure website where you can actually go in to enroll or opt out of the plan. You do need proof of alternative extended health and dental coverage to opt out of the plan. And you'll receive a credit to your student account about 4 to 6 weeks after the change of coverage period ends for the times that you were billed throughout the year. So how to claim? So once you have this plan, how to use it? There is a pay direct card right on our website in the download section, and you can see it on the right hand side. There's a download section, and when you go to studentcare.ca, you can search for Mohawk and you'll select the MSA, and then you're in the microsite for Mohawk. And like I said, on the right side, if you scroll down, you'll see the download section, and that's called the pay direct card. You hand that to the pharmacist with your prescription, and they would actually, for most medications, there are actually over 8,000 medications that are covered. They cover the portion on at the point of sale, and you would pay the difference, and you are done. And no manual claim is required afterwards. Keep in mind there is a period where if you're a new student, you will not be automatically, you will not be able to use the pay direct card automatically at the pharmacy until things are updated from the school to us and from us to the insurer, which takes place approximately 5 business days after the change of coverage period ends. So by the end of January, you should be all set up, and you can use the pay direct card anywhere else for anything that you paid for, including for prescriptions that weren't sent through the pay direct system, which is fast and simple. But if it's not set up yet, you can actually use our mobile application it's for Samsung or excuse me, not Samsung, my apologies, Android or Apple devices. And you can submit those claims directly to the insurer, and they're usually processed within 5 business days. Lastly, they're on our website. In the download section, you can download the claim form. And there's also a section on how to claim, how to fill out the form. You would actually fill it out and mail it to the insurer directly with your original receipts. And just an FYI for prescriptions, they do have to have all of the information of the pharmacy, your information. It'll have the DIN number, and that's the slip that's usually inside the bag that's signed by the pharmacist. So not the actual debit receipt, for example. That's a transaction receipt. That's not acceptable. So they have to be detailed receipts from all providers. So once again, I mentioned our networks. So the student care networks means we have agreements with these providers that give vast savings to students that are covered by this plan. Like I mentioned, you can go to your own, if you have your own dentist, that's fine. But before you go to your next visit to your own dentist, check to see if they're on our networks list, because you could actually be giving up up to a 30% savings for dental. So this is just a dental example of the savings that's available. So you're insured for 70% of preventative services. There's a 30% network savings. So you would actually, in the end, once it's all processed, would be 100% covered for preventative service. So that's a recall exam is an annual exam, for example. And then for basic services like impacted wisdom teeth, you're covered at 50%. And there's a 20% savings on every other category, as you can see in the network savings column. So you can see what your total coverage goes from the left to the right. If you use one of our networks, like I said, you don't have to, but it's tremendous discount. And if you go to a new patient exam, for example, at a new dentist, this plan would pay for itself on your first visit, because those are very expensive visits that include panoramic x-rays, and they're only covered once every 3 years. So tremendous discounts available. Great people. We have lists on our website from every city, every major city in the region, as well as across Canada, for people that maybe are studying in Ontario and live in BC, for example. We have networks across the country. So keep that in mind, because you can save a lot of money. And all of our dental providers, for the discounts, they actually bill directly to the insurer, which once again, you don't have to manually claim yourself. They take care of that for you. So that's a great thing for everyone. And some of the other networks, just for example, Psychology Network. We have pharmacy networks that give discounts at Rexall, 10% automatically with your Pay Direct card. Once everything's set in place, like I said, about the end of January for the new students starting in January, and you would get 10% off automatically. They wouldn't even know if you give the Pay Direct card to them, they would actually put that in, and it would automatically take the 10% off. And they may not even realize that you're getting 10% off, because it's automated right at the till. But they do have something as well, a 20% off regularly priced Rexall in-house brands. So that's a great savings as well. Vision, you can use a coupon code for online services at clearly.ca. And you can actually check on our website for those discounts as well. Clearly.ca has wonderful pricing, and 10% off contacts and 25% off eyeglass frames, excluding a few, but their prices are incredibly low. So it's a great help for students. The Vision Network for independent specialists, yes, 30% off prescription eyeglasses. Once again, if you have your own eye doctor, hey, that's a big savings, and up to $75 savings. And there's also discounts on eye exams and contact lenses through them. So keep that in mind. Also, a service that we offer with this plan is virtual well-being resources, and it's called Empower Me. So let me go through what is that. It's a multilingual mental health and wellness service. It has a number of professionals, various different professionals, psychologists, psychotherapy, social workers, nutritionists, all to support students. And it can be done in person, by telephone, by video conference, which is great during the age of a pandemic. And the app is available in the App Store and the Google Play Store. And what can you ask for help for under this? Stress or anxiety, relationships, interpersonal conflicts, time management, career counseling, and much more. So there's really no worries about if it's a small issue, if it's bothering you, use this service. It's a wonderful service. So I highly recommend them, and it's confidential. So you can take advantage of it. You can do video conferencing or on the phone. So it's a wonderful service. Okay, so back to you guys. Let's go back and let's see what we can do for questions.